নমস্কার, গুড আফটারনুন। আমি সমিত। আপনাদেরকে প্রত্যেককে ওয়েলকাম করি ইন্ডিয়া ট্রিটমেন্টস এর ফেসবুক পেজে। আজকে একটা বিশেষ দিন। আজকে আপনারা জানেন আজকে ওয়ার্ল্ড পিডিয়াট্রিক ক্যান্সার ডে। চিলড্রেন মানে ক্যান্সার ডে পিডিয়াট্রিকদের জন্য। তো সেটা আমরা কিভাবে এটা তো সেলিব্রেট করার বিষয় নয়। বাট আজকের দিনটা ইম্পর্টেন্সটা হচ্ছে এটাই যে আমরা যদি ব্যাপারটা নিয়ে একটু জানতে পারি বা বুঝতে পারি তাহলে বোধহয় আজকের দিনটা সত্যি সার্থকতা হয়। সো আজকে আমরা বেসিক্যালি কি জানবো সেটা যদি আমি একটু আপনাদেরকে বলে দিই তাহলে বোধহয় আপনাদের সুবিধা হবে নেক্সট ডিসকাশনটায় থাকতে আমাদের। কি ধরনের ক্যান্সার বাচ্চাদের হয়, হ্যাঁ, ক্যান্সার বাচ্চাদের ক্যান্সার বড়দের থেকে কতটা ধরনের আলাদা, কি ইনিশিয়াল সিম্পটম বাচ্চারা প্রডিউস করে, এটা আদৌ সারে কিনা। হ্যাঁ, তো এই ধরনের কোয়েশ্চেন্স গুলো আমরা আজকে আনসার গুলো নেওয়ার চেষ্টা করব এবং এই আনসার গুলো নেবো যার থেকে আজকে আমরা রিয়েলি ধন্য যে আমরা পেয়েছি ডক্টর সন্ধ্যাকে। সি ইজ ফ্রম রেনবো চিলড্রেন্স হসপিটাল। আপনারা প্রত্যেকেই জানেন রেনবো চিলড্রেন হসপিটাল ইন্ডিয়ার সব থেকে বেস্ট চিলড্রেন্স হসপিটাল। শুধু ইন্ডিয়া না, ইনফ্যাক্ট এশিয়ার সব থেকে ওয়ান অফ দ্য বেস্ট হসপিটাল। So I am really honored and thankful to Dr. Sandhya. Ma'am, welcome to India Treatments. Thank you so much that you have time
Thank you
to
for this
manage time.
opportunity.
Yeah, and from Hyderabad, you are connecting us. So thanks a lot. So, ma'am, my first question to you: how much is it common that cancers? How it is common the cancers are there in children? So, what is the prevalence and how common is this?
So, when you compare to adults, cancers in children are relatively rare, very rare. But because we are in a tertiary care center, we see a lot of cases. But in general, cancer in children is very rare. The incidence varies from area to area, from different countries. So, in Southeast Asian countries like India, Bangladesh, the incidence and prevalence of cancers in children is much lower than that in the Western countries, according to whatever literature we have. So, approximately maybe 1 to 2 in 10,000 children may get cancer disorder in their childhood. So, but it is in general pretty rare, not a common cause of mortality in children in India and Bangladesh.
Okay. What are usual symptoms kids produce? Because how people or as a parents they will get to know that this is a time to consult doctor. What are the common symptoms usually child produce?
So, when we talk about symptoms of cancer, so see, there are different types of cancers that may happen in children. The common is being blood cancer, but there are lots of solid tumors also. When I'm saying solid tumors, I mean cancer that arises from a solid organ. So, depending upon the type of cancer, the symptoms and signs will differ. Majority of these cancers have very non-specific symptoms. So it will be like they'll have fever, prolonged fever, which is not getting better with antibiotics or routine management, unexplained fever, unexplained loss of weight and loss of appetite, that is decreased hunger in children, children becoming very lethargic or refusing to play, pain or swelling, which has been there for some time, or sudden onset, rapidly growing swelling in any body part. All these can be a sign of something abnormal going on in the body, and it is a sign that the parent should consult a doctor.
Okay.
Very rarely,
You
there are
mentioned,
certain,
yeah, please.
sorry. So there
Sorry,
are
please
certain
continue.
tumors that happen very deep inside the body where the symptoms may not come up and they are detected incidentally also, especially certain renal tumors in children, very young children, called as WIMS tumor. Most of the time, it is detected incidentally when the parent takes the child to a hospital for something else like vaccination, and the pediatrician puts a hand on the child's abdomen and feels a mass. So rarely there might not be any symptom at all, and then it gets detected during a routine examination also.
Okay. Like you mentioned blood cancer. What are the different cancers are there basically in children's apart from
So,
blood
as I
cancers?
mentioned before, cancer in children is very rare, but among whatever cancers that happen in children, blood cancer is the commonest one. Almost 20 to 25% of childhood cancers are blood cancers. Again, this has different types: ALL, AML, B cell, T cell, and all. After blood cancers, the next most common is brain tumors. So, there are
Okay.
different types of tumors that may happen in the brain or the spinal cord. Then there's something called as a lymphoma, which arises from the lymph nodes or lymphatic organs. After that, there are other tumors that arise from the kidney called as WIMS tumor, from bone called as Ewing sarcoma, from muscle, from liver, hepatoblastoma. So these are the common cancers that we see in children. But there are other rarer forms also, which are like less than 1% of all childhood cancers also. But commonest one is blood cancer.
Okay. Is there any reason why cancer happens in children?
So this is a very common question that we get parents. So what unfortunately most of the cancers in children are idiopathic. When I'm saying idiopathic, I mean there is no specific reason why that particular cancer came to that particular child. Like in adults, you can always see the correlation that, you know, a person who's a chronic smoker can get lung cancer, a person who's a chronic alcoholic gets liver cancer and all that. But in children, usually there might not be any underlying cause. It is mostly an incidental disease. Some random mutation in the body causes cancer cells to grow. But there are certain genetic disorders which increase the risk of cancers, like inherited marrow failure syndromes, Down syndrome. There are certain genetic disorders which are present since birth. In such children, there is an increased risk of cancer. So, whenever such disorders are diagnosed, we keep those children under surveillance to look for early signs of cancer. But in general, majority of childhood cancers don't have any underlying cause.
Okay. So is there any basic difference between the adult cancer and the child's cancer? You,
Yes, there. See, whenever we hear the word cancer, most of the people take it as a death sentence. It might
Mhm.
be true for a majority of adult cancers, but pediatric cancers, let me tell you, most of them are completely curable. Most of the children do overcome cancer and lead a normal life. So that is one major difference between pediatric and adult cancers. So even when I say that major blood cancers or brain tumors also, treatment modalities are available which help children overcome the problem and lead a normal life. Other than that, another point is that most of the childhood cancers are idiopathic. They don't have any underlying cause, whereas majority of the adult cancers are secondary to some or the other disorder, whether it is lifestyle or physical disorders. And survival post treatment is much longer in pediatric cancers compared to adult cancers. Treatment also varies very significantly because children are growing. So, when you're dealing with a growing child, we need to modify the treatment very specifically so as to not affect the child's growth and development. That is why it is very important that whenever there is a case of pediatric cancer, a pediatric oncologist handles it because we understand the importance of modifying the treatment to adjust for the growth and development of the child and also to limit the long term mortality.
Okay. Okay. Yeah, we got a question, and the next question, even the same question I was going to ask. That is cancer curable in the kids group?
Yeah. Yes, definitely. Most of the cancers. So when I said the commonest being blood cancer, most of the cancers are curable in children with treatment. So this treatment is hard compared to other forms like treatment for any infections, dengue, malaria, or pneumonia and all. Compared to that, yes, definitely treatment for cancer is much more harder, longer. But that does cure the problem in most of the children. So
Okay.
this the curability of any malignant cancer depends upon the risk factors involved. So for solid tumors like brain tumor or a kidney tumor, liver tumor, we see the stage of the disease when the child is diagnosed. When the child first comes to us, at what stage the disease is. Based on that, we can say what are the chances that the child will be completely cured. Whereas in blood cancer, there are certain risk factors like the age of the child, what was the type of blood cancer, what is the initial WBC count, all that. Based on that, we can accurately determine what are the chances that this child will get completely cured. But in general, more than 50% children survive cancer in any type, irrespective of the stage and the risk group.
Okay. As you mentioned, ma'am, that it is a very hard treatment, right? So can they tolerate?
Yes, these the protocols that we use for treating cancer in children are different from that in adults. So these are specifically designed for kids and are based on their age and weight. So there are lots of studies going around in the Western countries as well as in Southeast Asian countries to design these protocols. So, as they're specifically designed for children, most of the children tolerate treatment very well. In fact, children tolerate intensive treatment better than adults because they don't have any underlying comorbidities like diabetes or hypertension or kidney disease. Like adult cancers happen in older populations, so they already have certain underlying problems that come with age. Most of them, some of them have diabetes, some have high blood pressures, kidney problems, and other problems, because of which their tolerance for the medications used is much lesser than for children. So, in fact, children do tolerate treatment better. That's why outcomes are better in children compared to adults.
Okay. Ma'am, when it comes to cancer, we generally understand cancer means surgery, then radiation, and one more thing is this
Chemotherapy.
chemotherapy. So, is the treatment protocol same for the child, or is there something else is there also for child?
Again, see, the treatment will depend upon the type of cancer. So, if we are dealing with a solid tumor like a brain tumor or a lymphoma or a kidney or a liver tumor, surgery is a very important part. But compared to adults, chemotherapy also plays a very important role in management of childhood cancer. Radiation indication depends upon the stage of the disease, how much of the tumor we are able to operate and all. Whereas in case of blood cancer, there is no role for any surgery. Surgery is not done. You give chemotherapy, and in some cases where indicated, we may have to give radiation. But surgery is not required in blood cancer. For solid tumors, yes, surgery, radiation, and chemotherapy, all three modalities would be required. Whereas in blood cancer, usually it is chemotherapy and radiation. Very rarely, in certain high risk cancers, we may have to go for bone marrow transplant or stem cell transplant to prevent the disease from coming back once it is under control. So, this sometimes in very high risk cancers, after they complete the initial treatment, the disease might come back. This is called as relapse. So, in high risk tumors, the risk of relapse is higher. So, in such cases, we may have to intensify the primary treatment. So, one of the modalities there is bone marrow transplant or stem cell transplant.
Okay. So, bone marrow transplant and stem cell are the same, or is there anything difference between that?
See, so actually, the correct term is stem cell transplant. So, what we are using to transplant is the stem cell. This stem cells
Okay.
are collected from a donor to be used for the patient. So, where do we collect the stem cells? Based on that, it can be the bone marrow or the peripheral blood or cord blood. So, bone marrow is a source of stem cells. So, when we collect the stem cells from the bone marrow of the donor, it is called as
So it is
bone
called
marrow
BMT.
transplant. Whereas, if we collect the stem cells from the peripheral blood of the donor without going for a bone marrow aspiration, it is a peripheral blood stem cell transplant. Or
Okay.
if we are using an umbilical cord as a source of
Mhm.
stem cell for transplant, it is called as a cord blood transplant. But because
Correct.
in majority of the cases previously bone marrow was used as the primary source of stem cells, so the term became synonymous, almost same as stem cell transplant and BMT is used interchangeably. But with
Okay.
the current advances in treatment to improve the donor comfort, so the person who's going to donate stem cells should not have any discomfort. For that, we use peripheral blood stem cells more commonly than bone marrow, because then the donor doesn't have to undergo any pain. There is no anesthesia. It is done on an OP basis. So the donor comfort is better. So we use peripheral blood stem cells. So when we say BMT, what we mean is stem cell transplant.
Okay. Okay. One more terminology we came across quite often, that is immunotherapy. So, how
Hmm.
important this immunotherapy is, and what is the role in pediatric cancer?
So immunotherapy is actually an extension of chemotherapy. What do you mean by
Okay.
chemotherapy? You give medications in the form of oral tablets or IV injections or IM injections according to. Based on that, you have other medications also which are more advanced. These are called as targeted therapies. So different cancers have different antigens on their surfaces. With the advancement of the medical science, we have now created medications that specifically target that antigen. So this is called as immunotherapy. So what happens here is that the medicine will target only the abnormal cancer cell, whereas sparing the normal cells. So the toxicity of these drugs is much lower. compared to the regular chemotherapy. But they also have their own other side effects. But immunotherapy is an immense advancement in cancers, which has improved the survival in most of the cases, even bad relapsed or refractory cases where the primary treatment is not working effectively or the disease has come back despite primary treatment. Immunotherapy plays a very important role to improve the
Okay.
survival.
Okay, okay. You just mentioned one thing, that is side effects. So, how is the life after this cancer treatment of children? Because they have a lot of life to, right? So,
Yes,
what is the
again,
life after
so
this?
that is one of the very important difference between pediatric and adult cancers. So where you
Right.
see in adults, when they get diagnosed with cancer, most of the people are in their 50s or 60s or even later than that. So the lifespan after recovering from cancer is not very long, whereas in children, 5 years, 6 years old children, they have at least another 60, 70 years of lifespan. So the medications that we use for pediatric cancers are also designed in such a way where there is a limitation in long-term toxicity. But despite all that, there might be some long-term effects, so for which we keep monitoring. But the incidence of this long-term toxicity is very less than 5% overall. So if you're treating 100 children with for cancer, less than 5 children will develop any long-term sequelae, and these are also manageable with medications. So but yes, this is something that we do keep in mind whenever we are treating a child with cancer, because it will affect our decision of giving the medications. But once the child has recovered from cancer, most of them lead a completely normal life. They go to school, they grow up, they have a job, everything is normal. Very rare. Uh, some particular type of tumors may have some effect on their some aspect of their life, but majority lead a normal life.
Okay. Before I ask my last question, before that, I just want to ask. You mentioned all kind of treatments. So, at Rainbow Children's Hospital, so you are providing all sort of treatments for these children.
Yes, yes. At Rainbow, we have all the treatments available for these children. And in the last 12 years, we've handled more than 950 to 1,000 children with malignant disorders. Me and our team, including my head of the department, Dr. Sirisha, and my colleague, Dr. Varshini, we have the pediatric oncology group here. So we have managed a lot of children with with this problem, and actually, I'm quite proud to say that our outcomes are at par with most of the Western countries because we have a very
Very
good
good.
support structure here. Being a pediatric hospital, it is very important to have other subspecialties to support these children who are undergoing cancer treatment because of the primary disease and also due to the treatment, they do have certain complications like they may get into infections, they may require blood product support. For solid tumors, pediatric oncology surgeon has a very important role to play. Neurologist, nephrologist, hepatologist, all of them have a role. So it is a group effort, a multidisciplinary team approach towards treatment of children with cancers ensures a better survival of such children. So, in that, yes, our hospital has all the facilities to treat such children,
Okay.
including bone
You
marrow
you
transplant, stem cell
you
transplant.
mentioned 950 plus, close to 1,000 you have treated. It's in Hyderabad unit only, or it's pan India? You have four units in.
Mostly, yes, pan India. And then this is in the last 12 years.
Very good, very good. So huge. So my last question is it preventable, or is there any way that we can prevent these cancers in children? Any tips from
So,
your end?
uh, so actually, yeah, this is another very common question that we get from parents, where they feel, is there something we could have done to prevent our child from getting cancer? So I would like to say here that, most of these cancers do not have a particular cause. So where we don't know the cause, there is nothing that we can do to prevent unless there is a specific genetic disorder in the family. Like if you have multiple cases of cancers in in a one particular family, then we do advise regular surveillance. Or if a child has some particular genetic disorder in which the incidence of cancer is more, in such cases we do advise regular surveillance so as to pick up if there is any development of any cancer, we pick up at an early stage so that treating it becomes easier. But because majority of cancers in children do not have any particular cause, there is nothing we can specifically do to prevent malignancy. What we can do from our side as parents and caretakers is give a proper balanced diet to the child, maintain hygiene, get all vaccines done regularly. If there is any unusual or persistent symptom in the child, always consult your pediatrician or your doctor so as to pick up in case the child has a problem to pick up early. In our country, the treatment in our countries, definitely the treatment is available for most of the conditions. The problem comes with delay in diagnosis or misdiagnosis or delay in approaching for treatment. That is the reason why we lose some children with to cancer. Otherwise, the facilities available are almost at par with Western countries. The delay in diagnosis and delay in starting treatment, it does makes the difference. So, though there is nothing we can do to particularly prevent cancers in most of the cases, but once you know that this is the problem, it is very important to start treatment as soon as possible to achieve the best result for the child.
Thank you, ma'am. Thank you so much. It was indeed a pleasure talking to you. It was seriously enlightening because, yeah, a lot of issues usually as a parents we have regarding safety and the way it is very common nowadays, pediatric cancer. So I'm sure that it will help many parents, and definitely the early detection will be the key. And if
Yes.
anybody who will be hearing us in future, because it will reach to a thousand of people, so will they be serious, and at least 1% of them will be take this message and embed this message. It will be worth having this discussion. Thank you so much, ma'am. It was pleasure talking to you. Thank you. So with the permission, I'm
Thank
going to end
you.
this session. Yeah, please go
Right,
ahead,
right.
ma'am.
Thank you so much for the opportunity on International Childhood Cancer Day. So, the theme of this year was through their hands, we can achieve the best results, better survival through their hands. So, we should all work towards better survival in children with cancer problems. Thank you.
Thank you, ma'am. Okay, bye.